There's your boy Chris from Chris and Push Sports Talk Radio, Bowie TV, coming to you live from UDC, University District of Columbia with Dr. Pope. Thank you for having us
Thank
today.
you for being here.
Now, if we can you introduce and give a little bit about yourself to our viewers and listeners?
Yes. Hi, everyone. My name is Dr. Pope. I am the president and CEO of Head to Speech Incorporated. I'm also a clinical instructor at the University of the District of Columbia in speech pathology as well.
And if you can you take us through today? We're here for your third annual, right?
Yes, my third
Head
annual.
to Speech.
Yes.
And we're talking about the importance when it comes to athletes, right? And it doesn't just have to be an athlete. It's going to be a regular, any old regular, anyday citizen, right?
Yes.
But particularly to athletes, we're talking about the preservation and the healthiness of our mind, body, right? Take us a little bit through what led you to this journey and to push it through and to come up with Head to Speech.
Of course. So we're here at the third annual Head to Speech Interprofessional Task Force Summit. And today is our Brain Health Sports and Fitness Expo. So it's been a 2-day event. Yesterday was the summit, and today is the expo. And I created Head to Speech because I wanted athletes to have the awareness about who was a speech pathologist, how was there a connection with cognitive tasks versus with the physical activities that they do, working out with their trainers and the athletes and their coaches, and making sure that we're integrating cognitive tasks into their workout. So we call it the brain workout. And we want to make sure that athletes and the athletic community know that athletes should be doing these tasks every day. It should be part of their normal routine.
Yes.
Because if we know that there are issues with brain health, but also issues with like sports concussions,
Yes.
right? And there are effects on cognitive communication skills. So some of those skills will be like attention, memory, problem solving, sequencing, planning, organization, social communication. And we know that athletes are doing all of these tasks. Like if you see some of the workouts that we have, they're sequencing, they're planning, they need their memory to remember the plays.
Yeah.
They need their reaction time, right? And so if you have a concussion, it only further impacts those skills, right, that we use and we take for granted. We take for granted those skills, those higher order cognitive skills that we use every day. So at Head to Speech, we're trying to make sure that the athletic community, we're bridging the gap between communication science and disorders and speech pathologists and the athletics community.
It's funny when you say that, right? And we talk about the athlete. So a short story that I shared about myself that a lot of my viewers already know about is that, so I was a two-sport athlete. I played football and baseball. But in high school, in my junior year, I was struck by lightning. So when that happened, when you talk about neurons and neurology, like, I didn't realize the effect that it had to the point where I wasn't able to continue to really play football anymore, right? Because I was told that if I had a head-to-head injury, it would cause paralysis or death. So when you talk about some of the things and you share the audio clip during your presentation, for me, a lot of the things that I do, because I suffer from migraines now, right? So whether it's the hearing or the vision, like there's sometimes where I drive at night with sunglasses on because
the sensitivity,
the lights, the red, the brake lights, even the front lights, they mess up my vision, or I lay in dark rooms a lot. So a lot of the information that you gave today was very informational for me, not just from an athlete, but from a personal perspective. Because even though I'm not an athlete anymore, personally, you still deal with the effects afterwards as an athlete.
Right, and we really also stress that we need to, one, educate athletes earlier. So we're talking about middle school, high school age, as well as collegiate sports, as well college age. But there's a continuum care there. So making sure that we're going in early, educating earlier, and then we also are staying with the professional athletes after they play, because we know that there's a period of it's a transition. Sports is transitional as well, and how we can support athletes through each transition. But we know that there's a period after you play. A lot of professional athletes that feel like I'm in a brain fog or my reaction time is really slow. But my thing is, you could be working on doing these brain workouts throughout the continuum of care and throughout your lifetime to make sure that you're preventing or even reducing cognitive decline, and hopefully preventing dementia and Alzheimer's disease as well. So we need more, especially Black athletes, right? We know that football is majority Black men,
Yes.
but we also have women athletes, that women football players as well. But we know that for men, like NFL, is majority 70% African American men. We need more African American men to be part of these brain workouts and to be part of research, brain
Yes.
health research. And so I'm part of this Black Men's Brain Health Conference. And this conference is during the Super Bowl every year.
Okay.
And we did this past Super Bowl. We were in Las Vegas and really trying to get Black men that are retired NFL players, a part of the NFL Network, Players Association, to sign up to be part of research. Black men,
Okay.
yeah. So creating safe spaces, and what's important for me is creating safe spaces for Black men to be able to just talk about these issues
Yes.
that are not, and yesterday we heard from our keynote speaker was Marcus Smith yesterday.
Right.
He's a 6-year NFL veteran, also a mental health advocate. And we've been working together, and he's really a big supporter of Head to Speech. I was happy that yesterday everyone was able to see it all come together. I mean,
Yes.
we've been a nonprofit organization for 3 years now, and so the next year, please come out and support, because we really need the athletic community to come out and support. We need student athletes to come. We need sports parents to come, because we want to be able to educate everyone
Yeah.
that needs this information. We want athletes to know what the next steps are, right?
Yes.
So some of our programs that we have are concussion recovery care packages. So the athlete has all the products, has all the resources, and has the next steps. So if I have a concussion, what do I do next?
Yes.
And you don't feel alone. Like, you have this organization, Head to Speech, here to support you. You have the resources to support you. We also do the brain workout. So if you're a coach, invite us to the practice so we can actually implement some of these cognitive activities. And I don't want the coach or the athlete to say, well, I don't have any room in my schedule for this.
But there's always room to protect your players.
Exactly. And so coaches have to look at their athlete from the holistic standpoint. We know you want to win, right? We know you want to win, and we want you to win. And we're not trying to take your players from winning, but we want, if you have one brain, so we have to think about the longevity of your brain. And would you rather come out of the game, get the treatment that you need, get the resources that you need during concussion recovery for 2 weeks, or be out a whole season? Because now you didn't come out the game, you had a concussion, you went back into the game, and now you prolonged your recovery.
Yeah.
You also, if you have 3 or more concussions, we know that there are, if you have 3 or more concussions, you may have longer signs and symptoms, or just long-term cognitive communication deficits. And so people are walking around with these issues because it's an invisible injury.
Yeah.
So it's hard to explain to someone that you have light sensitivity or noise sensitivity, you're having headaches, you're having memory issues, you're having trouble focusing. Even when you're talking to your coach needs to know that, because we all learn differently, right? There's different learning styles. Some people learn differently with auditory, visual, or tactile. There's 3 different learning styles, right? And so you need to advocate, and what we try to tell the athletes is to advocate for how you learn best. Like some coaches are yelling at the athlete and they shut down. Some people don't respond that way.
And that's true, because from when me and Push played, our coaches did more than just yell. Our coaches was vulgar. But we were receptive to it because we understood exactly what they were trying to relay. Where now, you have some players where if a coach react that way, they do shut down. They become secluded. They're no longer responsive.
Right. Yeah, we want them to be responsive. We want them to advocate for themselves on and off the field. Learning takes place on and off the field. You have to learn the plays. You have to go over the film, right? You have to be able to
the study habits.
Study. You have to be able to have good grades in order to play, right? To maintain those good study habits. And so that's where speech pathologists, you can really see that impact of working with the speech pathologist, because the speech pathologist is going to work on functional intervention.
Right.
Functional intervention, like taking those plays and breaking it down, making sure that sequence is right. You want your player to know the sequence to play, we're going to go through it play by play.
Yeah. So this is the 3rd year. Will it be here again next year?
It may not, I don't know. It may. but it may grow.
Yeah.
You know, it may. It. I think that we have about 40 to 50 people here this year. Next year, maybe 100 people. So we may need a new venue. You know.
Yeah. So this is my plea to all the coaches, especially in the DMV area, right? Coaches and players, high schools and colleges.
Yes.
This is something that you should, not can, but you should implement
Yes.
in your daily coaching routine
Yes.
because it allows you things to assist with your athletic trainers.
Yes.
It allows you to also be understanding of a diagnosis
Yes.
that somebody else may not see early on.
Right. And it's invisible injury
Right.
too. Yeah.
And it'll help you also to understand if a player, you think a player got a concussion and they still are out there performing athletically, but you notice there are some things off about them slightly. You know, take advantage of these opportunities to help protect the students to protect themselves.
Yes. Thank you so much for that.
So again, Dr. Pope, head to speech, Pitts and Push Sports Talk Radio, Bowie TV.
And they can find us. They can find us. Please follow us at Head to Speech on Instagram, Facebook. If you have any questions for me, please email info@headtospeech.org. Our website is headtospeech.org, and I will take your call. You can call me. Just email me first, and just I will sit down with you. Invite us to your practice. Do workouts. We're all about meeting athletes where they are.
Absolutely. Again, thank you very much. Pitts and Push Sports Talk Radio, Bowie TV.